Circumscribed otitis externa, boil in ear. Have you ever felt intense pain in one specific spot inside your ear canal? So sharp that even touching your ear feels unbearable. It might not just be a random earache. It could be something called circumscribed otitis externa, commonly known as a boil in the ear. Let's understand this condition better. Otitis externa, also known as outer ear infection, affects the ear canal, which is the external part of your ear. Now, there are two main types of otitis externa, diffuse and circumscribed. In diffuse otitis externa, the infection spreads throughout the ear canal. But in circumscribed otitis externa, the infection is limited to a small area. Usually, near the end of the ear canal, where hair follicles are present. That's why it's called circumscribed, meaning restricted or localized. The infection typically affects only 25% to 50% of the ear canal circumference. This type of infection is most commonly caused by a bacterium called Staphylococcus aureus. This bacterium infects the hair follicle inside the ear canal, forming a furuncle, or in simple words, a boil. The pain in circumscribed otitis externa can start as sharp and intermittent, which can quickly become continuous and intense. Even slight pressure on the affected part of the ear can significantly worsen the pain. Other common symptoms include a visible boil in the ear canal, tenderness and swelling in the affected area, pain while moving the jaw, other similar boils on the face. Interestingly, these boils are not always confined to the ear. They can also appear on the face or other body parts. So, it may require treatment from both an ENT specialist and a dermatologist. So, how is circumscribed otitis externa diagnosed? An ENT doctor will look for a visible boil inside the ear canal. But it might not always be apparent, especially in the early stages. The key indicator is localized tenderness, pain in a very specific area of the ear canal, unlike diffuse otitis externa, where the entire canal is tender. Once diagnosed, treatment usually involves antibiotics targeting Staphylococcus aureus bacteria, such as amoxicillin or coamoxiclav. But remember, these should only be taken under a doctor's supervision. Never self-medicate. Always follow the doctor's prescription exactly. Even if the pain goes away, don't stop the antibiotics midway. Stopping midway can lead to recurrence. In some cases, when the pain is so severe, or if the patient is not responding to the medication within 24 to 48 hours, a minor surgical procedure under general anesthesia may be necessary to drain the accumulated pus. Complications in circumscribed otitis externa are rare. Because the pain is quite sharp and hard to ignore, most people seek medical help early, which helps in quick recovery and prevents complications. So, if you ever feel a sudden, localized ear pain that worsens with touch or jaw movement, don't ignore it. Consult an ENT specialist immediately. To know more, please read our article, Circumscribed Otitis Externa, Boil in Ear. Link in the description. Stay healthy. Stay happy.